Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Misconceptions about hospice cause people to avoid it or even fear it. Patients can receive hospice care for up to 6 months and sometimes longer, but more than 40% of Medicare patients who use hospice are enrolled less than 2 weeks, which means they're not getting the full benefit of all hospice care has to offer. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Lisa Sather. Stay with us. Welcome back. There's nothing easy about facing a loved one's death. That's why taking advantage of all of the care and support you can get from professionals is so important. Joining us first this morning is Anna Shaw from Easter Seals Goodwill Northern Rocky Mountain, who is going to start our discussion about hospice and everything hospice care can do to provide comfort, support, and dignity to end-of-life care. Welcome, Anna.
Thank you.
So let's start with an obvious question. Most people have probably heard of hospice care, but what exactly are we talking about?
Okay. Hospice is a specific kind of care for patients approaching the end of life. It focuses on comfort and support. It's made for a time when the patient is ready to move from curative care to palliative care. So we're not trying to cure any disease, we're just providing comfort and quality of life.
Excellent. So hospice has been around for a while. This isn't anything new, is it?
No. Hospice, the word hospice goes way back to medieval times. When you think of, there were travelers, people going to Israel-Palestine area, and if they needed a stop along the way, or if they became sick, or if people in that community were sick, they could go to what were called hospices, and they were run by monks and nuns, and were a safe place, a peaceful place for people to go and receive care.
That's awesome. So that's probably why most of us have heard of it. And when should somebody really start thinking about hospice care? A lot of people wait to avoid it. What's your advice there?
Well, it's good for everyone to know what hospice is and when it's time to make that move. And think about when you might want to make that move. If you had a diagnosis that warranted it. It's different for every person. Usually when the doctor says you have a terminal illness, you have the disease that the doctor thinks will probably end your life, and the doctor's opinion is that you may have 6 months or less. That's when you can be referred and admitted to hospice. And the doctor has to make the order, so it's not something you do without information and support. You have a team around you.
Excellent. So how do people pay for hospice? Does insurance cover it?
Very few people pay anything for hospice. Medicare has a hospice benefit, and most of the patients that we see are Medicare patients. Medicaid also pays for hospice, and veterans benefits include hospice. Most private insurance companies have a hospice benefit. Beyond that, if someone has somehow slipped through all the cracks between those, most hospices provide care regardless of ability to pay. So if someone needed hospice and didn't have any other way to pay, most of us would just say, it's okay, we'll take care of you.
Wonderful.
Yeah.
So does hospice vary from state to state, or is it the same?
Considering that most patients are Medicare patients, we have regulations that are on the national level that we have to follow, and those are really the best practices and highest standards of care, so we apply them to all patients.
Excellent. So how does a person choose a hospice program?
That's a great question. You may have only one hospice in your community, if you live in a very small town, but you may have several. We like to tell people to go to Hospice Compare, which is a Medicare site. You can just Google Hospice Compare and you'll go right to it. that site allows you to find the hospices in your area that are Medicare approved and see actual data from surviving families of hospice patients, their responses to how their experience was with each hospice. And you can look at them side by side and find out what hospice are people having the best experience with. You know, it's also always good to talk to people in your community, talk to your doctor, talk to your friends and neighbors, and do your research for sure. You can also always call a hospice to ask questions. I know we would always be happy to help somebody understand what we do and what they can expect.
That's awesome. So where would someone receive hospice care at?
In our part of the country, in the Western US, most hospice is delivered at the person's home. Now, their home can be a house or apartment, or it could be a nursing home or an assisted living facility. All of those are considered the patient's residence, right? So our staff, the nurses and aides and social worker and spiritual care and volunteers can go into their homes and give them a higher level of care than they would receive. Even if they're at a nursing home where they're receiving a very high level of care, hospice is a step beyond that, because end-of-life care is different and intense and important. So that's how we mostly do it. Some places have residential or inpatient hospice, where patients can go and stay and live in what might be called a hospice house until the end of their life. I don't think there are many of those in Montana, maybe just a couple. But most people, when you ask them what they would wish for at the end of life, want to be at home. They want to be in familiar surroundings with their special mementos and their families and the foods that they're used to. That's most comfortable for most of us. So if we can deliver care at home, we think it's great.
Absolutely. We're going to have to pause for a quick break. Thank you.
Sure.
Hope you'll stay with us. Next, we're going to talk with a member of the hospice health care team and learn a little bit about holistic approach to hospice care. What does that mean? We'll find out right after this. Don't go away. Welcome back. Anna Shaw is still with us, and joining us now is Roxanne Closey, Assistant Vice President for Clinical Services. Both ladies work for Easter Seals Goodwill Northern Rocky Mountain. Thanks for being here, ladies.
Thanks so much for having us.
Absolutely. Roxanne, let's start with you. So what is a hospice plan of care?
So when someone chooses to come on a hospice service, what we need to do is look at the different ways that we're going to take care of that individual. So hospice is more of a holistic approach. We're looking at all different things as far as being able to manage that individual's care, and not just the patient. We want to look at the family as well, or their significant other, anybody else who's a part of that individual. So we look at things like, obviously, nursing. Nursing is really important, making sure that they have the medications that they need and any therapies that they need. Social work is an integral part of what we do, and making sure that they have the resources in the community. We also look at the spiritual care component, and what we do with the plan of care is we try to identify how many times we need to go and visit with that patient. So how many nursing visits, how many social work visits, and so on. So that's really what the plan of care is, and we reevaluate that every 2 weeks, making sure that we're addressing their needs.
That's wonderful. So it's not something that's just really kind of nice to have. Is a plan of care necessary for insurance coverage? How does that work?
Plan of care is a necessary component. It's the right thing to do. It is one of the stipulations as far as reimbursement is concerned from Medicare, Medicaid, the different insurances, but it's the right thing to do for the patient and making sure we're addressing their needs.
And I think you hit on this a few minutes ago, but maybe even a little more detail. So a hospice plan of care just really isn't about physical health. It's about other aspects. Is that right?
Emotional, spiritual. Having gone through the process with family and having somebody die is it's not just about the physical body no longer functioning. It's about that emotional attachment and the emotions that that individual has had, and how the family will be able to deal with it. The emotions that they feel as they're going through the dying process, and that detachment from their family. So it's definitely something that has to be addressed, as well as the physical being.
So the plan of care for the patient and the family, and so when it comes to the family, are there any other specifics that you get into? You've mentioned that just briefly, but for the family, what, we're talking about?
So bereavement, are they at a high risk for bereavement and being very emotionally drained when that person does go? Have they had a lot of loss in their life and where they need that support? And part of one of the criteria for being a hospice program and having that reimbursement from Medicare, Medicaid, insurances, and so on is a 13-month bereavement program that is offered by our social worker.
Wonderful. So what is your role in the hospice program? What do you provide?
So I look at my responsibility primarily as making sure Anna and the other hospice staff have the resources that they need in order to take exceptional care of our patients. So I'm a nurse first and foremost, and have been a nurse for a long time. But now, instead of taking care of the patients, I get to take care of my staff and make sure that they have what they need to take good care of our patients.
So at what point does a clinical manager come in during the course of care?
The clinical manager is going to oversee that plan of care and making sure that things are addressed. If there's issues with getting in touch with a family member or a physician because that patient needs something more, or if they are at risk for maybe wanting to hurt themselves, getting the social worker involved so that they can do an evaluation. If they are talking about not really knowing what's going to happen on the other side or after death, maybe that's the spiritual care component. So the clinical manager basically is that sounding board to hear what's going on with the different patients, and then can help identify the appropriate resource.
That's wonderful. So we were talking about the plan of care with Anna earlier, and talking about those plans to be tough because it forces the patient and the family to think about death and dying, of course. Can you talk about the process of developing that plan in light of everyone being in such a tough situation?
So what we try to do, the dying process is almost like labor. So when a mom is giving birth, they're going through all of these different emotions and these different physical feelings and so on. The act of dying is also somewhat laborious. And so we try to educate the families and the patient. These are some of the signs and symptoms that you're going to see or you may experience as you go through that dying process. It's kind of scary. And so what you want to do is help make them as prepared as possible. We don't always achieve that, and it still is very scary, and that's part of being able to look at the family, look at that support system for that individual, because once they're gone, that person has experienced death, and that's not an easy process. So we want to make sure that they have the resources that they need in order to be able to overcome that.
Can I just add something that I've noticed? I've been working with hospice nurses for just over 3 years now, is that when our nurses are communicating with patients, they are direct, they're very honest, they don't sugarcoat anything because that's really not helpful, but they speak with so much compassion and gentleness, and I think that comes from probably their years of experience in helping people through those tough situations.
Thank you. That's great. Thank you for adding that. We have time for one last question, Anna, and so to you, the spiritual care component, that's part of what you do. Can you speak to that briefly?
You know, I feel just so fortunate to be able to do that work. Spiritual care in hospice is a little different from what most people might think of when they hear the word spiritual. It can be kind of whatever the patient needs it to be.
Awesome.
I may help a patient get in touch with a priest or a pastor. Some patients just want me to keep them company as a spiritual care person. some patients need me to pray with them or provide some music. We have a really wonderful volunteer program in our hospice called Threshold Choir that can provide really peaceful, beautiful, spiritual music. And it's amazing how that can change the mood and spirit in a room. So there are lots of things we can do.
Thank you. We're going to pause for a quick break. Up next, we'll be talking more about hospice, and we'll meet another member of the hospice care team. Stay with us. Thanks for staying with us. Anna Shaw is here, and joining her now is Josh Pate Terry, a hospice social worker. Welcome back, Anna, and welcome, Josh. So which members of the hospice team are responsible for providing care that's not related to the patient's physical well-being?
Right. So that's Josh and me in our hospice.
Awesome.
Some larger hospices will have a larger staff for that. We're a pretty small operation. So I'm the spiritual care and volunteer coordinator,
okay,
and Josh is our hospice social worker.
Excellent. So can you talk a little bit about what volunteers do? What roles do volunteers play in the hospice program?
So each hospice can run that a little differently. Our volunteers provide primarily social support. So they're there to be a friend, play a game of cards, hold hands, go for a walk. Simple things that just a friend would do. And for a lot of patients, that may be one of the few friends they have. You know, we have patients who are in nursing homes all by themselves, and maybe all their family members have passed before them or live far away. So we try to really make sure those patients have volunteer support.
Awesome. So Josh, let's focus on the role of a social worker. What do social workers do for a hospice patient?
So social workers have, our job comes in a whole bunch of flavors. It'll start off a lot of times with assistance with end-of-life planning or access to community resources. But we also deal with all of the emotional and mental health aspects of care. Hospice care is very holistic, so we look at a wide variety of aspects of the patient's life. And so at one point I might be helping them apply for Meals on Wheels, and then at another we might be doing bereavement counseling for anticipatory grief or grief due to loss of ability.
So you mentioned bereavement counseling. So I know the hospice, the social workers can be also involved in helping with the family. What other roles do they play in helping, with the family members in addition to bereavement?
And caregiver support is a huge part of hospice, and a lot of that falls under my umbrella as a social worker. So I'm going to provide emotional and mental health support to caregivers, making sure that they don't suffer from caregiver fatigue. We're going to deal with any anticipatory grief, that's grief before the patient dies. And then I also do all of the bereavement counseling. So after the patient dies, I provide that counseling to those loved ones and caregivers as part of the hospice service.
Thank you. So inevitably part of the hospice process is the passing of the patient. And what do you all do to prepare the patient and the family for the patient's death?
So a lot of my job is going to be about using their strengths. This is going to be a strength-based system. We want to look at what are your strengths, what are your coping tools that have worked for you in the past, and how can we use those to make this transition as comfortable as possible. And this is both for the patient and the caregivers. It's going to be a lot of give and take. It's going to be about getting a feel for what's the best in this particular situation, and then just providing that care and that support.
So hospice care obviously doesn't end when the patient passes. Can you talk about, and I think you hit on this earlier, Anna, but about the grief and bereavement counseling that happens, even after the patient passes?
So part of our role as a hospice organization, part of our requirements is that we provide bereavement care for 13 months after the patient passes away. In my organization, we get a little more leeway. I can provide that care beyond that 13 months. And we also provide care to the community. But what would happen is a client would come in after their loved one passes away, and I would do a bereavement assessment. And that would give me sort of a roadmap of where they're at in the bereavement process. And then when we would build whatever tools necessary based on that, whether it's counseling or if it's something more serious or intense of a grief process.
Thank you. So this is a controversial topic, but physician-assisted suicide is legal in some states, Montana being one of them. And I would imagine, because of the care you all provide, that there may have been instances where someone has sought counseling around this particular subject. How do you and your team address this situation?
So it's important to know right now in Montana, physician-assisted suicide is legal because of a court ruling, but there's no legislative basis for it. So we don't know of any physicians who are willing to test that. Sure. And it's really, we certainly have had patients ask about it, but it's not part of our goals in hospice. What we want to do through the care that we give is make it more desirable to live out the natural lifespan than to choose something like that. And we can do that with pain control. We can help with other symptoms that, that may be distressing for a patient, addressing their environment, making sure that it's safe and comfortable for them, and supporting the people around them. And most of the time, we find that's enough for people, and that's what they really need.
That's wonderful, thank you. We're about out of time, but maybe each of you could summarize in a few sentences any final thoughts that you might have that you'd like our viewers to hear. Josh?
Biggest thing for me as a social worker is that bereavement services are probably one of the more important tools that we have, and probably the most underutilized. So don't be afraid to take advantage of bereavement.
Wonderful, perfect.
Yeah. For me, something that's important to know and something that really inspires me is that hospice care is the same for everyone. It doesn't matter if you are, a former elected official, or if you're homeless, or the color of your skin, or the life that you've had. Everybody is offered the best care that we can give. And to me, that should be how we function all the time in this world.
Agree. Thank you both. Your passion is quite evident. Thank you for being here. We want to thank Roxanne for being here as well. And of course, thank you for tuning in this morning. We'll hope you'll come back and see us again next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.